guys, my name is Takeyah. I am an orthodontic assistant, and today I'm gonna explain to you guys what it's really like working with multiple doctors. I have been an orthodontic assistant for a while, and I'm now working at my second practice. I had 2 doctors at my previous practice, and I now have 2 doctors currently. Basically, go ahead into detail how to juggle working with 2 doctors in one practice. Make sure you subscribe and you have your notification bell on because I do orthodontic assisting videos every Tuesday. I also do content with my family every Friday. All right, let's get right into this video. Let's go. So I've previously worked with 4 different type of doctors. They all were different. They all had their own style and did things their way. Whenever you have 2 doctors in one practice, typically one doctor is the boss, which they're the owner, and the other doctor is simply an associate or an employee. At my previous practice, one doctor was the owner, he was the boss, and the other doctor was an employee. So the owner, the boss, he worked full-time. He was there a lot. The other doctor, he was an employee and he only worked part-time. And he was, working on, slowly retiring, kind of transitioning into that role. Both doctors were older. This practice that I worked at was an older practice. So they did things basically, I would say more traditionally, but they were always open to learning new things, and we did do a lot of new things within that practice. First doctor, which was the boss and the owner, he did things really different. When he wanted to put braces on, he would, of course, start from the lower left side. Like most orthodontists, they start from the lower when putting braces on. But he typically wanted the premolars, which are also known as the bicuspids, which are also known as the 4s and the 5s. He would like to have those 2 braces handed to him sideways. So initially, when you hand the orthodontist the braces, also known as the brackets, you would just pick up the brace and the bracket straight on with the bracket holder. However, this particular doctor wanted everything straight on except for the 4s and the 5s. So that was always one thing to remember. That doctor also liked working with certain instruments. So you can have different types of instruments that you use when, aligning the brackets, also known as the braces, once you put them on the teeth. So this doctor liked using a white carver, which was also called a white handle, when putting the braces on. He also put on his retainers differently. We did a lot of bonded retainers at my old practice, and he loved using the braided wire, which was a standard retainer. And whenever I worked with him and I had a patient who was getting braces off, I would always have to remember when doing retainers to get the braided wire. The second doctor in this same practice, when he did retainers, he liked to use a different type of retainer, and he liked to put bends in the wires. So before placing the retainer, the bonded retainer, this second doctor at my old practice, he would bend the wire. Also, when putting his braces on, he liked everything straight on. He didn't want any of the braces on sideways like the other doctor. Also, this doctor, instead of using a carver or white handle like the other doctor, he liked to use a scaler when aligning the brackets. Also, this practice, they loved to check everything before the patient left. So even though we were doing all of the work and we were there for a long time and they trusted us, they never dismissed a patient without coming over once all of the work was completed. They were really particular about their work and particular about seeing the patient before they left, just so they can make sure everything was done the way they wanted to and that, you know, everything was fine. So whenever I would finish working on a patient, I would have to call the doctor to my chair when I was done at the very end, and then they would give me the okay. And both doctors did this. And whenever we worked, we only had one doctor for the entire day. We didn't have both doctors when we worked. So at my old practice, whenever like we worked, it was just the same doctor the entire day. So we didn't have to flip-flop like whenever we grabbed patients. So whenever I worked a Monday and Dr. So-and-so was there, I knew Dr. So-and-so would be there the entire day, and that I would be, you know, working the way he liked that entire day. I didn't have to worry about seeing who's coming to my chair and seeing which instruments to switch, or, you know, how to, you know, prepare myself. So that was a good thing. So like before each day started, I would like prepare my instruments and prepare what I was going to do based off which doctor was working that day. My new practice, we currently have 2 doctors. At this practice, it is a newer practice, and the doctors are way much younger. So they typically do things a little different from my previous practice. So with my 2 doctors, we have one doctor who is the boss, who is the owner, and then the second doctor is an employee and an associate. The second doctor is part-time. Even though they are a young doctor, they're not transitioning into retirement like my last practice. This doctor just works part-time, and the other doctor works full-time. So the owner, that doctor, he works a lot. Like he's pretty much there every day. And the second doctor, they work 2 days out of the entire week. At my current practice, they're less hands-on, you know. They trust us a lot and give us more responsibility. So the doctors, they will come over either before or sometimes after. It just depends on the appointment. So typically when I call a patient back, it's already written in the chart what we're going to do. So then we just go ahead and do the work. Once we finish the work, the doctor will come over and check. However, if it's written in the chart that we may need to get, you know, a doctor's review on what's needed, the doctor will come over before. The doctor will tell us what's needed. We'll complete the work, and then that's it. They won't come back to the chair. So that's something that's different. I mean, either way, the doctor will see what work was done, because when the patient comes back, the doctor will see it at the next appointment, because the doctor still comes over at each appointment. It just depends on what we're doing that day, if the doctor will come either before or after the appointment. So the first doctor that I work with currently, they like putting on braces, you know, straightforward, starting from the lower and just working the way all the way across. So it's really simple. That doctor also likes to align the braces with the carver once the braces are placed. And this doctor does not do any bonded retainers. Totally different from my previous practice. It's really more like conservative, because we just do clear retainers or either a holly retainer. We do bonded retainers if the patient had significant spacing prior to treatment, and if a bonded retainer is needed, me as the assistant, I will do the bonded retainer. Or we have one person who's really good at retainers at my practice, and that person usually will do the bonded retainer. But if that person's not available, I will just go ahead and do the retainer, depending on, you know, what type of retainer it is and if it's not complicated. For my other doctor that works at the practice, they like to put on braces differently. they start from the lower, but they like to start from the lower back to the center, and then they'll go back from the back on the other side to the center. So instead of just putting on braces all the way across in order, this doctor likes to go from the back to the midline, back to the midline, back to the midline. And I think that's really cool because this doctor does it so they don't have to reach over when putting on the remaining braces. This other doctor, they don't do bonded retainers either. We, the assistants, will do the retainers. Also, this doctor, they don't use the carver when aligning the braces. Once the braces are put on, they will use, the back end of the bracket holder to align the braces. We will sometimes have both doctors on one day. So like my last practice, I never had to juggle back and forth during the day trying to figure out who I'm working with or what kind of style or instruments will be needed. But in fact, at this practice, I do have to check to see who's coming to my chair, make sure I have the instruments the doctor likes, and, prepare myself on how to, hand over the braces and how to set up. So, for example, if I have both doctors on one day, I will have to see who's walking to my chair. If I see that Dr. So-and-so is walking to my chair and Dr. So-and-so likes to put on braces from the back to the midline, I have to make sure that when I'm handing the doctor the braces, I hand the correct brace in the correct order. If the other doctor comes over, I have to make sure I do it his way. I have to make sure I have his instruments. So now whenever I'm working, I just always check to see which doctor is about to come to my chair, and then I'll just prepare for, what's needed and what we're about to do. You'll find that when you have two doctors who work together, they're always like cohesive when doing treatment plans and trying to, give the patient the smile that they want. So the only difference was, how they achieved the same goal. They just achieved it differently, but they both had the same goal. And, it was just simple things that you had to like literally tell yourself, like, okay, hey, I'm working with so-and-so today. So just know whenever I do retainers to grab this retainer. Or, hey, I'm putting braces on with this doctor. Let me make sure I grab these instruments. There's lots of different ways to achieve the goal, and there's a lot of different, techniques when, tying in wires, doing appliances. I've seen so many different things now that I've been working for a new practice, and definitely when working with all of these different type of doctors. So I just want to go ahead and let you guys know that don't ever get caught up in, learning a certain style or working with, a certain type of doctor or person, because you never know if you're going to get a new doctor. If you do get a new doctor, that doctor is going to have their way that they do braces. Or you may go to a different practice, have to move and work somewhere else. You're going to have to then learn how to, do things their way. You never want to get too comfortable and caught up in a certain way and, doing things with a certain person, because it can always change. You have to just be like quick on your feet, really adaptable, and willing to learn different styles. Go ahead and comment any questions you have. Give this video a thumbs up if you learned anything new and if you enjoyed it. Go ahead and also comment anything you would like to hear from me. Make sure you have your notifications on, you're subscribed, because there'll be another dental video next Tuesday at 5:30. Thank you guys so much for watching. Bye.